I'm James Swartz, managing attorney at Swartz & Swartz. Blunt force head trauma can lead to serious brain injuries and a lifetime of permanent disabilities, but they can be pretty difficult to diagnose at times. So some of the symptoms of blunt force head trauma include dizziness, feeling tired, unsteady on your feet, numbness in extremities, headaches. So a lot of symptoms that taken by themselves might seem innocent enough or maybe typical. But if you've been in an accident that involves a head injury, don't ignore those symptoms. Make sure you get medical attention. So how are blunt force head trauma injuries diagnosed? So certainly the symptoms I mentioned are used by medical professionals as an indicator of head injuries and brain injuries. But also there are specific tests that can be done to further diagnose what's going on. So in addition to observing symptoms of certain head injuries, doctors will use certain tests to further diagnose. So for example, the Glasgow Coma Scale is used to measure motor response time, eye movements, and those types of things. Also, imaging can be used to reveal whether there's damage to brain tissue. And then other tests may involve language assessments and neuropsychological assessments as well. With regard to treatment of such injuries, sometimes the injuries can really heal themselves over time. However, other times, the injuries are much more significant, and those will require surgical intervention and perhaps months or even years of physical therapy or occupational therapy. Blunt force trauma head injuries can be caused in many different types of accidents, including truck and automobile accidents, sports accidents, construction site accidents, among many others. The bottom line is, if you've suffered a blunt force trauma head injury as the result of someone else's negligence, contact Swartz & Swartz.